Before I get to the ctDNA testing or MRD testing, let's look at the conventional way of how we risk stratifying the colorectal cancer recurrence. So it's called TNM staging. So T referred to as the site of the tumor, N referred to as the lymph node. The way I usually explain that to my patient is that if you want to go from Sacramento to San Francisco, you have to get to the freeway. And lymph nodes are just like that. If they wanted to go from colon to the liver or lungs, they hop onto the lymph node. So that's N. M is the metastasis, so that means the cancer are already spread to the other part of your body, just like in general in liver or lungs. So this TNM staging, we can only predict the probability of recurrence for each stage. For example, if you have stage 2 colon cancer, your risk of recurrence is 20%. What that means is 2 out of 10 patients will have a recurrence. But the problem with TNM staging is we don't know which specific 2 patients will have a recurrence. On the other hand, ctDNA testing or MRD testing can really pinpoint which 2 patients out of that 10 patients will have recurrence. The 2 patients who are positive for the ctDNA or MRD testing have almost 100% chance of recurrence. So they will be offered to the chemotherapy, and the rest of the 8 patients who will not have a recurrence based off of that negative testing will be spared from the adjuvant chemotherapy. SIGNATERA is the personalized tumor-informed blood testing, which follow the minimal residual disease after surgery or specific therapy. So your blood test is uniquely designed from your own tumor. In my opinion, there is 3 advantages with this testing. One is very sensitive. The test can detect a single tumor molecule in the blood tube. 2 is very specific, meaning if the test is positive, your chance of recurrence is almost 100%. And that which I think is the most important for oncologists and then for the cancer patient is that it's increased lead time. So the SIGNATERA testing can predict the recurrence 9 months before the cancer will show up on the CT scan. So then we have more time to act on it. So the expanded access program has 2 advantages. One is convenient. The company will send a mobile phlebotomist to the patient's home with full PPE, and the patient can get tested without needing to come to the medical center. And the second is there is no cost to the patient for the service or the test. So let me give you a few examples that I have used during COVID-19. As you know, younger patients are diagnosed with colorectal cancer during the recent few years. So I have 30-year-old patient who was diagnosed with stage 2 colon cancer. He was recently resected, And we got the SIGNATERA testing after surgery. Once the SIGNATERA testing result came back negative, he and I can discuss the risks and benefit of chemotherapy, especially during the COVID-19 period, more objectively and specifically to his tumor and his recurrent risk. Because his test is negative, we have decided to hold off on the adjuvant chemotherapy and to delay this surveillance CT scan as long as the SIGNATERA test has been negative. So that's one of the examples that I use in early stage disease to weigh in on adjuvant therapy. And the other area that I have been using is those patients who has complete response to immunotherapy. Again, patients of my age had widespread metastatic rectal cancer. Fortunately, he had complete response to the immunotherapy and he no longer needed the immunotherapy. He currently works and lives 3 hours away from our medical center. So we do the video visit for symptom checkup. He will get the SIGNATERA testing from the expanded access program, and he will go to the local Quest Diagnostics Center for blood counts, liver, and kidney functions, so then we can closely follow his cancer recurrence without him driving all the way back to the cancer center. Cancer will not wait for the pandemic to be over. Surveillance is important for detecting the recurrence early enough so that we can intervene, either by the chemotherapy or surgery, to prevent the cancer becoming the terminal incurable stage. Like I mentioned before, with the increased lead time provided by SIGNATERA testing, we can do something meaningful for those patients who are positive for the ctDNA and very high risk of recurrence. Now that we are several months into pandemic, we are seeing more late-stage cancer diagnosis at the cancer center because, the patient has been waiting for the pandemic to be over. So I would like to suggest folks who has symptoms to see the physician right away to get diagnosed earlier. The prognosis is a lot better if you have diagnosed it before the cancer spreads. For example, if you are diagnosed with stage 2 or 3, it's still curable, but stage 4 isn't. And even if you have diagnosed with stage 4, if we can intervene early before the organ damage like liver or kidney, we have a number of treatment options available to extend your life. And medical center has been very proactive with the social distancing, COVID-19 check-in, temperature check-in, and using the mask and face shield.